Arha. She is the coordinator of volunteers here at the Medicare Assistance Program, but that's just one part of what her role is here. She helps clients on a daily basis with their questions about Medicare and just the same stuff that all of our counselors do. But bigger than that, she also is sort of a liaison with several of the agencies that we work with across the state here in Oklahoma, giving them support, ideas on how they can improve their program, feedback, things like that. And then on top of that, she also coordinates our training program for all of our counselors across the state. So, she makes sure they've got the curriculum that they need. She makes sure they get their tests taken. She maintains a database. So she's got a lot of different roles, wears a lot of different hats within our program. But today, she's here to speak to us specifically about Medicare Supplement policy. So Anna, take it away.
Thank you, Ray. We'll get started right here. So for Medicare Supplement insurance, it goes by a lot of different names. It's also known as Medigap or secondary insurance. And these are all sold by private insurance companies that are designed to pay after Medicare. So it helps with those co-pays, co-insurance, and deductibles from the Parts A and B of Medicare. So that may be when you're going into the hospital, if you're an inpatient, that Part A deductible can be paid for by a Medicare supplement, or as well as the 20% coinsurance after Medicare pays 80% on your Part B covered services. The supplement is going to help pay that 20% afterwards. They are standardized policies, so every single company does have the same benefits for these plans, and they're labeled by letters. There's 10 different ones available right now, and with letters A through N. And those are not to be confused with the parts A, B, C, and D of original Medicare, Medicare Advantage, and the drug coverage. They just also happen to be named with letters, but they are different policies. So these are regulated at both the state and federal levels. The way you want to shop for a policy for this is, first of all, of those 10 different ones available, they each have a different level of coverage. So you want to identify which of those benefits that are most important to you to make sure that they're covered. And of those 10, then we can actually help you obtain for what is available. And we have a software that we use to get the prices for all the companies so that you can help make that decision. It's called Medigap Plan Finder, and it's available to all of our trained counselors through a website that we use, shiptacenter.org. And we do have a consent form that you must fill out first before we're able to provide that information. So once you fill out that form, we will get the quotes for whatever plans you're requesting. And it has the prices, it has what their ratings are, and it also shows how long they've been charging that price. And it gives a lot of good market data to help you make a decision as far as which company you want to go with. Just to give you an idea, there are about 50 different companies that sell the Medigap policies in Oklahoma right now. And those are some of the same companies that sell other products like the Medicare Advantage or the Part D plans. So since a lot of these companies sell multiple things, you want to be very clear about what you're shopping for and make sure you're asking for the right things. So some criteria that you have to meet to get a Medicare supplement. First of all, you do have to have both Parts A and B of Medicare. In most cases, somebody who just has Part A, they wouldn't need a supplement anyway because they probably have their coverage through their or their spouse's employer. So once you're needing the supplement, you would need to have both Parts A and B in place, which those are signed up for through Social Security. And then you have to pay a monthly premium for a supplement. So that's not to be confused with the Medicare Advantage plans that may not charge an extra premium on top of what you pay for Part B. You're always going to be paying for a premium for a Medicare supplement. So that's another way to distinguish between those. They are only covered for one person, so you are buying individual policies. However, many companies do offer household discounts, which is also indicated on those quotes that we can obtain for people. If more than one person in the household purchases a plan from that company, then a lot of them will offer a 7% discount on premium if you do so. These are not for prescription coverage. So that's when you have to have the Part D plan to get that prescription coverage. So again, the Medicare Supplement will only help pay after your Parts A and B, and it will only pay once Medicare has approved those claims. If Medicare denies the claim, then the supplement also will not pay. So there's a few different ways that the supplement companies determine what they charge for these plans. The first one is called no age rated or community rated, which means you're paying the same no matter what your age is, and that can be the least expensive over a lifetime. There's only one company that's doing it that way in our state right now, which is United Healthcare. For the issue age rated, it's based on your age when you purchase the plan and won't automatically go up due to age. So that one maybe starts out a little bit higher, but it's not expected to have as much of increase as the last one, which is called attained age rated, where the premium's based on your current age and it does go up each year as you get older. So there's only about 2 or 3 companies doing the issue age rated. So all of those 46 other companies, they're doing the attained age. And that's indicated on the quotes that we'll pull for you as well if you're needing that information. Prices can go up due to other things unrelated to these factors, such as inflation. So keep that in mind as well. So the absolute best time to purchase a Medigap policy is when you're in your open enrollment, and that's actually based on the Part B start date on your Medicare card. So there are a lot of different open enrollments. We use that term a lot with Medicare that applies to many different things. So the fall open enrollment that we're in right now is for the Medicare drug plans, Part D, and the Medicare Advantage plans, or Part C. It does not apply to these Medicare Supplement or Medigap plans. So the open enrollment for those is the first month that Part B goes into effect. So for many people, that is the month they turn 65 if they start their A and B at the same time. But for people who stay working and have coverage through an employer over age 65, then they can delay that Part B and preserve that 6-month window to be guaranteed a policy, because they don't need to apply for Part B until they're no longer covered through their employer insurance. So these are all kind of things that we help talk with people about to make sure they're making the right decisions, because it's the best time to buy within that first 6 months. Outside of that, you could be denied for pre-existing health conditions, or you could charge more because of them. And during that 6-month window, they're not allowed to charge you more for any pre-existing health conditions you may have, and they can't deny you coverage. So that is basically the only time that you're guaranteed to purchase one of these plans, except for some other special circumstances. So outside of that, like I said, they can charge you more or they can decline a policy altogether. You'll have to go through a health underwriting process. And based on any hospitalizations you've had or any surgeries, any health things going on with you, they will take that into account and determine whether or not they want to sell you a policy. So outside of that 6-month window that we just talked about, you can try to purchase and change this type of plan at any time of year. So there's no other designated time to change it, but you just aren't going to be guaranteed outside of that first 6 months from the Part B start date. So 2 of the 10 plans that were the standardized plans available, they have actually been phased out for anybody new to Medicare as of this year. So if you were eligible for Medicare prior to January 2020, then you can still purchase either Medigap Plan C or F, or if you already had it, you're able to keep it. It's just that no new people are going to be able to purchase them anymore. And because of that, that means that risk pool of the people who are in that coverage is getting smaller. So it's getting people who are getting older and sicker that are in that pool, which means that the costs may end up going up for the people who have those plans still. So the next best options to that now are plans D and G, which again, that's Plan G, not the Part D for prescriptions. But those will be the next best coverage that's still available. And the reason they got rid of that is because both of those plans paid the Part B deductible, which this year is $198. And the Affordable Care Act had a requirement to eliminate type of coverage where you had essentially no out-of-pocket costs. So the Plan G covers everything that the Plan F did, except that you have to pay that first $198 deductible. So we don't know what that amount yet is for 2021, but with the Plan G, you'll pay the first $198. So basically that's your first doctor or medical visit of the calendar year. And after that, it would pay everything else. They also are offering that in a high deductible option, which has about a $2,400 deductible. So if you're never really using your insurance, but you want to have that just in case, then you can have the high deductible option where you're paying a much lower premium, typically about a third of the price. And then you have that high deductible should something catastrophic happen. You wouldn't be responsible for anything after that $2,400. There are some special stipulations for people who are on Medicare due to disability. So federally, unfortunately, there's no protection that there has to be a policy sold for people on disability. So there's no national laws related to this. But in Oklahoma, we do have a law where the insurance companies must offer at least one of those 10 policies that we discussed during that 6-month open enrollment period. And that's going to typically be Plan A. So not the Part A, but it's called Plan A. And that's the one that they'll offer for people who are on disability. So that one does pay the 20% after the Part B pays 80%, but it doesn't pay that Part A deductible if you were to go into the hospital. So it does help cover all the medical, but you still would be out of pocket your deductible if you were to be hospitalized. So when someone is on disability, that means they're under 65, and they'll have that 6-month window from that month their Medicare goes into effect, which again, they can delay it if they're covered through their spouse's employer. But then again, when they turn 65, they will actually get on another open enrollment where it's almost like they're starting Medicare again for the first time. So they'll have 2 open enrollments for a supplement based on when they first started by getting on disability, and then again when they turn 65. Another rule that we've enacted in Oklahoma is that when somebody's in that 6-month open enrollment, they're not allowed to be charged more than somebody who's 65. So right now, they're able to get the same rate that a 65-year-old would for that Plan A. While before September 2017, people on disability were getting charged 3 and 4 times as much per month in premium as somebody who was 65 or older. So luckily in Oklahoma, we do have that protection where they can't be charged more than a 65-year-old during that open enrollment window, which, to give you an idea, is typically around $100 a month for the Plan A for someone on disability. They're still limited to one of those 10 plans, which again will typically be the Plan A. And it wasn't retroactive, so people who already had purchased plans prior to that date weren't able to get the new rate. But anybody new getting one since that date is able to get that lower rate. So some things to know about Medigap and Medicare Advantage plans is that it is illegal to sell a Medigap policy someone who's enrolled in Medicare Advantage unless they have the intention of returning to original Medicare. And that's because these plans don't work together. So Medicare Advantage has copays and deductibles and coinsurance, and some people think that they can buy a Medicare supplement to pay those, but that's not the case. They don't work together. So if you're enrolled in Medicare Advantage, then that is your only coverage. You can't have a Medigap plan as secondary to that. If they have it and enroll in a Medicare Advantage, then they also would want to drop their Medigap plan because that's no longer going to pay since they're not getting their benefits through original Medicare at that point. So if you kept it while you're on Medicare Advantage, then you'd be paying a monthly premium for that Medigap plan that's not going to pay anything on your behalf because your coverage is only through that Advantage plan at that point. They do have a stipulation where if you have had a Medigap plan and you're trying out a Medicare Advantage for the first time, then that first 12 months, you would be able to be guaranteed the Medigap plan you had previously and return to original Medicare. So they give you a trial first year to be on Medicare Advantage. And as long as it's within that first 12 months, you are guaranteed to go back to what you had before. I just got a little ahead of myself on that. But this is what I just talked about. So if it's still available, then they are able to get it back. But if not, they could pick out a different one from that company and still be guaranteed that coverage. If you do that as well, you'll have to re-enroll in the Part D to get the prescription coverage. So we can help people do that anytime within that first 12 months if they're trying out Medicare Advantage for the first time. Another thing is that you can suspend a Medigap policy. So the reason why some people may need to do this is they were on Medicare and had their Medicare supplement, but then they go back to work and are able to get insurance through an employer. So they can actually suspend their Medigap where they're still enrolled in it, but it basically puts it on pause where you don't have to pay a premium during that time and you won't get any benefits, but you will automatically be able to restart that once you don't have the employer coverage anymore. You can do that indefinitely as long as you're covered through the employer coverage. But if you're somebody who is getting qualified for Medicaid, then it does have a time limit of only up to 2 years that you can suspend it. So mainly this will be happening if somebody's going back to work and then they will suspend it for that time period that they don't need it. And that way they're guaranteed to get it again without having to reapply. So that is the end of our presentation for Medigap. And now we'll take any questions that people have. Thank you so much for tuning in today.
Great job, Anna. That was really good. Very concise, accurate information, well laid out. Excellent job.
Thank
as
you.
far as questions go, one question that came up was in the process of doing the application, a person who was in their open enrollment period, there was a questionnaire that covered a lot of those health questions that you were talking about. And they were told they still needed to fill out that form, even though that the company couldn't use that information to apply to the rate. Is that correct?
Yes, I believe it is. I think they're still allowed to request the information. It's just that they can't deny you coverage because of that. Isn't that correct, Ray?
That is correct. There is a pre-existing condition clause that they can implement in some situations, and that information might be applied in that situation. So, next question. The comparisons that you guys are able to do of the Medicare supplement policies, if someone wants to get one of those done, do they have to go through the mail? Are there other ways that they can get this information back and forth with us? What are their options?
Yes, so we can mail you the form. We can also do fax or email. And we have, since most of us are working from home nowadays, it's probably easiest if we can email you the form. But we do request that you either mail or fax it back because it does have secure personal information on it that's best not to be transmitted over email. But then we are able to email you the quotes back. So that's the quickest way to get you the information that you're needing.
Okay, great. Another question. If I have a Medigap with a local company and I move to another state, can that plan go with me?
Yes, it can. The one thing I guess I didn't say, the Medigap companies are nationwide and they're accepted everywhere in the country that takes Medicare. So when you move, that policy can go with you. However, your rate may be adjusted because you're in a new zip code. And the zip code is one of those qualifications that determines what your rate is. But you won't be given a guaranteed issuance if you want to change Medigap when you move, because those do travel with you and work nationwide.
Okay, great. Do either of the Medicare Part B or Medigap plans have a yearly out-of-pocket maximum?
No, the Medigap plans do not. So you pay your monthly premiums and they will pay their portion no matter how much that ends up being. So that's one distinction between Medigap and the Medicare Advantage, is that Medicare Advantage does set a maximum out of pocket for the year where you're not responsible for any amount beyond that maximum. However, with the Medicare supplements, because it already covers you after you're on the Plan G, after you pay that $198, it already will cover all of your costs after that point. So there is no maximum.
Okay, next question. And I think you did mention this in your presentation. Can you change Medicare supplement policies if you find a better deal than you originally had? And if so, what would be guaranteed issue as your first choice was?
It will not be guaranteed issue if you're outside of that 6-month window from when the Part B began. So you can, of course, change if you get a better rate, but you would not want to cancel your current policy until you're actually approved for the new policy, and that way you won't go without coverage.
Okay, I believe that's all of our questions. Thank you again, Anna, for that presentation. It was really, really good. Folks, I want to remind you, if you've got any additional questions based on today's presentation, you can call and talk to one of our counselors at 1-800-763-2828, and someone would be happy to help you. Wanted to remind you that we've got other webinars that are going to be coming up. Next week, October 27th, Gay Humphrey from the Centers for Medicare and Medicaid Services is going to be joining us, and she's going to be speaking on Medicare Part D prescription drug plans. Talking about what drugs they cover and why it's important to review your drug coverage annually. Then the following week on November 5th, Jose Olivero from the Social Security Administration is going to be here talking about the different benefits that are available, how you apply, also why it's important for everyone to sign up for what's called a mysocialsecurity.gov account. And then the last webinar is going to be myself and Michael Fry talking about, how can you assist your senior friends and relatives and stuff without violating their rights. There's a very fine line involved in that situation. So we hope you can join us for some or all of those webinars. And again, if you want to sign up for these, just like for this one, you can go to our website at oid.ok.gov and go in there and sign up for whichever of the events you'd like to attend. And hopefully we'll get to see you at those events. And that's all we've got for today. Thank you again for joining us. Have a good day.